Our study was a cross-sectional retrospective data. So that means we used data from between June to August 2024. And it was a snapshot of the data. And our main concern was on ketonuria, as we are going to see as we progress. So basically, when we get to the introduction, we all know ketonuria is the presence of abnormally high concentration of ketone bodies in urine. And we have three of them, as the chart has illustrated. We have acetone, we have acetoacetate, and then we also have beta hydroxybutyric acid. And then the causes of ketonuria, there are several. One of them is diabetic ketoacidosis. The other one is starvation or prolonged fasting. And the other one is vomiting or diarrhea, and also low carb diet. That means when you take low concentration of the carbs, the rice, and all that. And our study really focused on Salgaa. Salgaa is a very small population, and the high population is measured on the people who are on transit. They are the major population as compared to those who live around the estate. And now we directed our study on the importance of point of care testing, because we use the urine dipsticks, and not only are they affordable, they are timely, and they are also reliable. It is important to note that we cannot do away with point of care testing, especially in the resource limited setting like our facility in Salgaa. On the objective of our study, we had three. So number one was to assess the prevalence. How severe is the issue of ketonuria among the population? And we used urine dipsticks. And then number two, we did not only want to know how the prevalence is, we also wanted to associate the prevalence in terms of age and gender, so that we can know, are the children mostly affected? Are the older people mostly affected? And then number three, we categorize cases by clinical relevance. We as scientists, once we know the prevalence and the pattern, we have to know clinically how is the data important to us. So we categorize them into four: diabetic ketoacidosis, starvation, vomiting, and the other unclear causes that we are going to look as we move forward. Our design was cross-sectional retrospective data. So that means, retrospective study. That means we used data that was collected between June to August 2024, and cross-sectional. We took a snapshot of data at that particular time. And then the setting was our facility. It's called Salgaa Health Services Clinic. It's along the highway. And then we analyzed 50 patient records, and we focused on the records that met inclusion criteria. And that includes the level of the ketones, the gender, and also the age. And then to our point of care testing, we focused on, as you can see, it's URS 10T reagent strips. I know we all use we have interacted with it some time back, the normal ones, the urine dipsticks. And then we interpreted in terms of millimoles per liter. And then from trace to very high, as the image is showing, we have from negative, trace, small, moderate, and then large. Now, it is important to note, the urine dipstick, the pad for the ketone to detect ketone bodies, it is coated with sodium nitroprusside. And then when it is put in an alkaline medium, the urine dipstick, one of its limitations, let me just mention, is that it only detects acetoacetate, not the other ketone bodies like beta hydroxybutyrate, which is the main ketone, especially in DKA, and the other one, as you are going to discuss. So when we come to the demographics and the testing approach, as I have mentioned, we consider the prevalence in terms of age, gender, ketone levels, and clinical presentation. And then we went on to group the findings in terms of clinical category, so that we can be able to manage the patients better. And then we also used statistic with tables and charts for better presentation, as we are going to see as we move on. So when we come to the results, and this is the most interesting part that we got to find out. The 50 patient record that we analyzed, 23 of them, they tested positive for ketonuria. Now, considering the population in Salgaa, as I have said, the population is small. So that is like 46%. That prevalence is huge when it comes to that population. And out of the 23 positive cases, 15 of them were female. So we can see that there is a high burden among the female, and we are going to discuss in terms of how other studies have related female when it comes to ketonuria. And then in terms of age, the most cases were among the young adults between 20 to 35 years. So this is the distribution of patient with and without ketone. The blue one represents the 23 cases that was positive, and then the red one represents negative for ketonuria. We also categorized our results in the second way. The first one we categorized in terms of prevalence. Number two is the severity of ketonuria. Yes, there is presence of ketonuria, but how severe? Because we do not want to just say ketonuria exists and it's an underlying condition among the population. We want to know how severe it is so we can better manage the patient. We categorize the severity into 5 from trace, that is 0.5 millimoles. The cases were 3. The mild and the moderate cases of ketonuria, each of them was 2. High cases of ketonuria was 9, and then very high cases of ketonuria were 7. And I'm just going to come to this slide to show you how the cases was distributed in a bar graph for better understanding. And then thirdly, when we come to clinical categorization, we categorize them into 4. From those 23 positive cases, we wanted to know how can we categorize, because we want to help. We do not want to stop at knowing the prevalence. We also want to educate the community on how they can be able to prevent such metabolic condition. So 5 of the cases were suspected to be related to diabetic ketoacidosis. 7 of them were related to starvation or prolonged fasting. 2 of them were related to vomiting or diarrhea, especially the younger children. And then 9 were associated to other unclear causes, and I'm going to highlight on why. And then you can see the children were linked to either vomiting or diarrhea. And then the older adults were the ones who were categorized among the unclear metabolic causes. This is also another presentation of the clinical relevance of ketonuria cases in terms of the 4, like I've explained, DKA, starvation, vomiting, and other causes, unclear causes. So now when we come to the higher prevalence, in terms of our interpretation, as I've mentioned, the females were the one who were prone to such issue of ketonuria. And I remember we asked ourselves question, why are women mostly affected? And we had to relate this result in terms of study. So studies have shown that women during prolonged fasting, women they experience a faster rise in excretion of fatty acids and ketones, and this is because of either social factor or personal factor. When women want to achieve body goals, they go low on carbohydrate diet. When they want to maintain weight, that is what we do, and that can prone us to such issue of ketonuria, and it can lead to DKA, and it can lead to diabetes. And then among the young adults, we linked their positive cases in terms of dietary habits. As I mentioned, Salgaa is a transit. The town, most of the people, they are transiting from one place to another. And when they visit the facility, some of them might not have taken something to eat because of maybe busy schedules, they are fasting, and all such kind of things. So dietary habits, meal skipping, and like I've said, weight control practices can result to such issue. So relating our study to the theme of this conference is point of care testing on patient diagnosis and management. Our study emphasizes mostly on the routine urine screening. Like I've said, we cannot do away with point of care testing, especially the clinics that are in the rural areas. It is very important that we consider POCT. And now this is just a presentation of clinical relevance of ketonuria. We as medical practitioners, it is important that once we find a problem, we also need to offer solution. So among the cases that were suspected to be diabetic ketoacidosis, we recommended immediate insulin or glucose therapy, especially among the young adults between 18 to 35. Among those who are linked because of starvation or prolonged fasting, it is important that we offer nutritional counseling. Let us explain to them, yes, it is okay to control your diet and all that, but let us also inform them the implication when you do it, like when you overdo it. Among the population that was linked to vomiting or diarrhea, they need rehydration and supportive care, especially the younger children. It is important for us even to train the mothers to educate them on the importance of diet among the children. And among the other unknown causes, especially the older adults, it is important for us to further evaluate and make a follow-up because they are prone to such issues because maybe they do not have enough information, they do not have people to take care of them. So it is important to follow up on them. Now, when we come to our conclusion, the prevalence of ketonuria was 46%. That is a high burden considering where the clinic is located. And the dipstick, the urine dipstick, like I've said, they are affordable, they are timely, and they are effective for early detection. And there is need for nutritional education, diabetes screening, and also public outreach. We really need to educate the community. And it is important that when we educate them, we tell them what we do and what they can do so that we can collaborate together in managing such condition. So our recommendation, there were 4. We need to integrate dipstick screening in routine visit. Anytime a patient visits there, just encourage them to take such kind of test because they are affordable, they are fast, they are timely. And then number 2, we need to raise awareness on dietary and metabolic risk. Many people, yes, they do know that about diet, they know other issues like high blood pressure, they know about random blood glucose level, they know. But when it comes to such issue of ketonuria, it is metabolic, it is related to metabolism. So when we educate them, and we can be able to prevent such case. And then the third is follow-up lab testing. Our study was retrospective. That means we used data that we had already collected. So when it is a prospective data, you can do a follow-up. Once a patient record high concentration of ketonuria, you can proceed further because they are suspected to have DKA. Proceed further, do blood glucose level test, and you can be able to prevent such cases such as DKA. And then finally, we need to educate the community. It doesn't matter where your facility is located, we need to integrate community education and also teach them on how they can improve their lifestyle when it comes to diet. And that brings me to the end of my presentation. Thank you.